So here we are with Gloria, a great patient of ours who gave us permission to talk to you today a little bit about her experiences in our office so far. So, Gloria, can you tell us a little bit about your condition, what you were suffering with before you started coming here?
Well, I've had low thyroid problems for a long time, and I've been on medication. And as a result, there were times where it may have helped when the medication was introduced, but later on I experienced difficulty sleeping, low energy, just brain fog, couldn't remember names and places and even activities. I really was not able to complete my even household chores on a regular basis.
Right.
And so I just felt that this was not living and there had to be something more.
Okay, so did they tell you had suffered with a thyroid problem?
Yes,
Yeah.
I have had, my doctor tested me and had put me on medication for many years.
Okay, and so were you told actually that you had Hashimotos?
Yes.
Okay, all right, so you're dealing with a thyroid problem, and the classic thyroid symptoms also with patients are difficulty losing weight as well.
Definitely.
Right, and so what were the doctors doing for you? Just giving you the medication?
More medication,
More medication.
increase in dosages.
And I guess at some point you felt that you need to try something else? Is that what it
Yes,
happens?
I just felt that my energy level was not improving. I had difficulty with the sleep, falling asleep, and also waking up, feeling as if I have had a good night's
You
sleep.
felt rested.
Mm-hmm.
And then how did you find out about our office?
A friend of mine told me about it, and I said, well, I may as well try this.
Right, and so we had a consultation, we reviewed your blood work,
Yes.
and then we began.
Yes.
So tell us a little bit about what some of the experiences of your office and what you're feeling now that you didn't feel before.
Well, the office staff was very helpful and supportive, available. Anytime I called,
Right.
they were able to help me and encourage me. David in particular helped me to think about recipes and research things that I could use.
Right.
Initially, I was a little challenged because I had been used to my comfort zone of the different foods that I like.
Right.
But with help and encouragement, I was able to find foods that were really helpful, and with the knowledge that I gained, I was able to make better choices for what I would eat.
And how are you feeling now?
Now I feel better, much better.
Right.
I think there's more to go, so I wouldn't say great,
Right.
but I can sleep with, I have a more restful sleep now,
Right.
and I am able to fall asleep faster. I can do much more activities within my house. I can complete chores and really feel like I've accomplished a lot.
That's great. And
Mhm.
how about weight-wise?
Weight-wise, I've lost quite a bit, which is sort of like a side benefit,
Right.
but it's very encouraging to see the weight
Okay, so
go without effort, without the effort that I was putting
how much
into
is
it.
quite a bit?
I've lost 19 pounds.
That's awesome. So
Yes.
you gotta brag about that. All right, that's awesome. So what would you tell anyone that may be skeptical because they're not sure that this would work for them? It worked for you, but not for them, or insurance doesn't pay for a lot of what we do. So what would you tell someone who's skeptical that may not think that this program is for them?
I would say that your health is very important. There's so many ways in which life happens because you're healthy, and I would say that if that is worth something to you, it's worth it to make the sacrifice to be able to see whether or not you're doing what you should to improve the way your body functions.
Right. Yeah. And it's worth the investment.
It's worth the investment, absolutely.
Great.
You know.
Awesome. I think that's great. Thank you so much for sharing today.
You're welcome.
Great.
I really appreciate the staff here, and I appreciate that you are doing such an awesome job.
Well, thank you.
And teaching us how to take care of our bodies.
Oh, good. Big hug after this.